My name's Steve Green. I'm the Executive Director at Scripps Mercy Surgery Pavilion, and we are a 4 operating room surgery center, freestanding center. It is a hospital joint venture, so we have hospitals, our general partner, and then we have 21 limited partners that are surgeons. And we do a large number of cataract procedures, a large number of pain management procedures, and then a little bit of everything else, podiatry, general surgery, GY and neuro. So we're a multi-specialty center. We do about 500 cases per month, and we have about 35 staff members. Prior to using the Edge patient satisfaction surveys, we were using another vendor where we were getting all of our surveys out to patients on paper. Some of the problems and challenges we had with the survey process that we were using was, one, the data was old. By the time we got it back, a lot of times the patients had already been at our center maybe 4 to 6 weeks after they were getting their survey, because we were doing a monthly upload. Even sometimes when we would do our upload every 2 weeks, we were still getting information back from patients that wasn't very close time-wise to when they had their procedure done. The previous vendor we were using was one that our hospital system had been using across their whole market. And most of the places using that were hospital-based providers. They weren't outpatient-based facilities. So we were looking for something that was a little more expedient, a little more geared specifically towards surgery centers. The process we used to find the solution for our patient satisfaction surveys was really pretty much tied to the fact that we had a good relationship with Source Medical. We've used Source Medical Advantix for our patient billing platform and admitting platform. We've used the Source Medical EHR for our electronic health record. So we had a lot of confidence that this partner with Source would do a good job for our patient satisfaction surveys, and we thought it would be something we could give a try. Well, our current process now for our patient satisfaction survey is greatly improved. Our patients get an email the day after their surgery case that will give them a link to log on to the EdgeSurvey, and they can take their survey all online. One of the concerns we had at the beginning was that our patients wouldn't all be giving us email addresses. We do have an older population, and we did have concerns that our older folks wouldn't really use email that much or be a little reluctant to do things online. And we found that really not to be true. It's very common for everyone to be using email and shopping online and using the internet. So we actually saw a really good response rate from our population with getting the surveys online. So we have quick turnaround on the information. We're getting the surveys back within a couple days. We're not waiting until the end of the month to get a report. I get surveys every day that I can look at and see what people are providing feedback about. If there's any negative feedback from a patient, I get an alert, so I can go into that survey specifically and find out what patients are not happy with, or what's something we can address immediately if it's something pretty significant. So we're getting quicker data, number one. Number two, we're getting a lot more data. We're getting a much higher response rate on the electronic surveys than we were getting on our paper surveys. In fact, it's almost double. We're getting almost a double the response on the electronic surveys. And what's even better still is that we're getting this much more data at about half the cost what we were paying for our paper surveys with our previous vendors. So we're getting information quicker, we're getting more of it, and it's costing us about half of what it was costing us before. We learned how to do the data transfer in about 20 minutes. The training for the staff, there was virtually none. We just trained a couple people on how to upload the file, and we basically had to help our staff remind the patient to give us their email address so we could send them the email for the survey. But other than that, there was very little training. The training primarily was for me in terms of getting the data out of the surveys. We get a monthly report, and I can log onto the site and basically peruse a variety of different reports. The data is collated at the end of each month, so I can go in and look at trends. The data is more than I can even have time to look at. There's data by physician, there's data by question, There's, collated data for almost anything that you could think that you would want to look at. The reports are pretty concise, and the summary reports are basically perfect format for me to take to my governing board each quarter so that we can look at what's going on with patient satisfaction. And it has proven to provide us with some information to drive some quality improvement activities, looking at what patients do and don't like. One of the things we found was that patients thought that their waiting time was too long, so we looked at some ways to shorten the amount of time they had to come in before their procedure. Other things like just waiting room appearance and comfort. So that kind of feedback from patients is great, and it's nice to be getting specific information from them in a much more timely basis. I definitely recommend the EdgeSurvey to other surgery center administrators and colleagues. I think the amount of information that we're getting and the expedient way that we're getting it, and especially the cost savings, would make it well worth anyone trying it out.